Okay, welcome everyone. We're going to go ahead and resume. I want to welcome you to session 3 of the conference, which is on planning for dissemination and accountability, looking at communication strategies that sit alongside evaluations to shared learning. Let me begin by introducing myself. I'm Steve Woolf. I'm the Director Emeritus of the Center on Society and Health at Virginia Commonwealth University. I happen to be a strong believer in the importance of thinking about communication strategies early on in evaluation processes. During this session, we're going to highlight the role of communication and better understanding how to measure and achieve impact toward health equity and systems change. This includes communication with the community itself, as well as case making with decision makers, funders, policymakers, and other stakeholders. What we'll hear about in the presentations that are coming in the next few minutes is the importance of understanding the notion of power, as we talked about earlier in the afternoon, on communication and whose voices need to be centered in that process, building trust and relationships and meeting people where they are, speaking to what matters most to the audience, working with colleagues and partners to measure what matters, not just what we know or think will make us look better, and balancing the need for clear messaging with honesty about what is working and what isn't. So let me take a few minutes to introduce our speakers. We have 3 speakers coming up. The first is Amber Banks. She is a Senior Director with Frontline Solutions and the founder and CEO of the Center for Trust and Transformation. She leads the Frontline Learning and Evaluation practice. Mark Cabaj is president of the consulting company From Here to There, and is also an associate of the Tamarack Institute for Community Engagement. Prior to this, Mark worked at several agencies in the Polish government and in Canada, coordinating the Waterloo region's Opportunities 2000 project on poverty reduction. And our final speaker, Hanh Yu, is the Chief Learning Officer at the California Endowment. There she oversees learning, strategic development, evaluation, and impact activities related to the Endowment's Building Healthy Communities initiative. So we have a very talented group of speakers, and without any further ado, I'm going to suggest we get started with Amber.
Thank you, Dr. Woolf. Hello, everyone. It's wonderful to be here with you all today. I would like to kick us off and just start talking about power initially when we think about communication. So when we think about communicating evaluation results and evaluation processes, it's important to think about who has the microphone. So this often comes down to timelines and processes in terms of who gets to determine what questions get asked, what data is collected and how the data is stored and shared, how we analyze the data and make sense of it, and how we communicate the findings. Most importantly, this all adds up to what gets done as a result of the findings of our evaluation efforts. And so all along the way, asking the question of how we can craft more inclusive processes to give ourselves a runway to make power sharing more intentional along the way as we think about communicating our activities around evaluation. Next slide, please. So trust. Trust is something that is always rooted in history, context, and identity. And our relationships to data and each other are no exception. And so as we think about the example here that I wanted to share is around Black mothers. I'm a mother of 2 young children, and the statistic that's often shared around Black mothers are 3 to 4 times more likely to die from complications around pregnancy and childbirth than white women. This finding is rooted in historical context and a history of systemic racism and differential treatment of Black women. And it's important to recognize these findings and these truths as we understand and communicate what we're learning as we go. So the history and context of this reality can be critical for understanding the importance of trust, relationship, and messengers as we communicate our learnings. So for example, we have 2 different groups here who will interpret the findings of our evaluation work very differently. And you could add multiple groups to this, including policymakers, funders, and other groups. And so when we're communicating findings and really hoping to catalyze positive change, we have to think about the audience and who the trusted messengers are. So in this case, it doesn't necessarily mean that the most trusted person is the person who has the most information or the person who conducted the study. As Dr. Stinson shared, trust is by what you do and not what you say. And so it's important to recognize and utilize trusted messengers in order to communicate findings. Next slide, please. Finally, accountability. So there's a lot, this is a loaded word, so I just want to name it. Accountability can mean a lot of different things in a lot of different contexts. In many cases, accountability is acknowledging what's important to the audience and being aware of what we are bringing, the power dynamics, the coded language sometimes that can be used, and what we're bringing to the table. So centering our awareness and honesty and humility is something that we do at Frontline and we work with our partners on as well. And so we really think about accountability to whom and whether the evaluation paradigm that we're using is supporting us to be able to tell the story of how our clients and partners are holding themselves accountable to the outcomes that they seek to see and the communities that they seek to serve. In many cases, this requires balancing perhaps findings that are not as positive with asset-based framings as well. And so there's lots of data on a lot of the inequities that we see out there in the world currently that we're fighting to upend. And we also know that the communities that we work with and the clients that we work with bring multiple talents, expertise, and insight and wisdom that we can leverage in order to better understand the problems we seek to solve. And so it's important to think about what the current evaluation paradigm is and who it's working for and who it is not working for. We want to be careful about reinforcing these deficit narratives in our communications and walk the line between reporting accurate data and keeping an abundance frame. So ultimately, we're asking the question of what needs to shift in order to enable deeper relationships and how we center learning as the goal. With that, I'm going to pass it to Dr. Yu. Thank you.
Great, thank you so much. So I'm Hanh, Yu, Chief Learning Officer of the California Endowment. I just want to start by thank you for being part of this wonderful panel and also acknowledge the land that I come from, which is the land of the Lonely people. So apropos of communication, I want to start a story just in terms of how I came into this work as a woman of color. And so let me just share my screen real quickly as I'm talking. Before I joined the California Endowment, I remember walking through the hallways of the conference center. And I just stopped short of my track when I saw this image. So let me share it with you and let me know if you can see it. Okay. So what I saw was something that I'd never seen before in my whole existence in the United States. And that was because my family had come to the United States as refugees from Vietnam. And at a young age, and throughout my upbringing in California, I felt the weight of a nation struggling with its conscience from a failed war. And I experienced a constant reminder of being a stranger from a foreign land, where I heard constantly, "Where are you from?" And I would say, or want to say, "I'm from California." And then people said, "But where are you really from?" So that reminded me that I didn't belong. And so this image of Amy Lynn, larger than life on this wall at the conference center, said so much to me in so few words. It said to me, "You are seen, you belong here. Your voice matters. You are deserving of rights, of quality healthcare, of education." I wish I had seen this in my youth. It would have made such a world of difference. So I come into this work proud to join a foundation with such innovative communication strategy around healthcare for all, around schools not prison, and the Rise Up as One that says, just in terms of the narrative of inclusion and who is deserving of rights. So then I felt a little bit of extra pressure being the Chief Learning Officer, having commissioned such a significant body of knowledge around what it takes to advance health equity in California, United States, to develop an equally compelling communications campaign to talk about our work from building healthy communities. So then let me go to the next part. And so that's what I'm going to be talking about, is a case study of the California Endowment and how our evaluation communications work has been set up to support the building power in community as well as building health equity. And so a little bit about the building healthy communities. It was a 10-year, almost $1.7 billion initiative in 14 communities throughout California. And you can see those on the map right here, as well as statewide in California. And so our goal in it was to change local and statewide policies and systems to make sure that we improve and increase access to opportunities of all kinds of services for our communities, including health, housing, safety, and food. And that we want to fundamentally shift how we think about health and who belongs, and promote health equity, racial justice, and inclusion in the process. And so this is our theory of change that we wanted to communicate. And that we wanted to kind of turn it on its head, because the dominant public health approach to addressing health inequity was and has continued to focus largely on the medical model, which emphasizes specific diseases and technocratic approaches that are built around improving health education and literacy, as well as the intensification of medical services. TCE's BHC strategy of building healthy communities is instead based upon the recognition that health inequity is fundamentally a failure of democracy. We believe that robust participatory democracy is good for health, and particularly for communities that have been politically and socially oppressed and marginalized as a result of racism and other forms of structural bias. We come into this with the recognition based upon compelling data and research that shows that when it comes to your health in the United States, your zip code is more important than your genetic code. Our building healthy communities approach focused on deliberate enhancements of local community power, primarily through intensive community organizing in order to create greater influence over policy making by people who are most impacted by health inequity. And so what did we learn through this $1 billion investment? We decided to call it, this is the ABC of our learning, where we have come to this simple formula, and A stands for agency. And again, turning it on its head, it's not about individual agency, because individuals don't often have choice in structural inequality, but collective agency, community power. And that's the first part. The second part is about belonging, which represents the inclusive spirit of our beloved community through coalition development, alliance building, healing circles, and more to instill a sense of togetherness. And then C is for changing conditions in which people live in that impedes health. So, so we knew we wanted to advance that as part of our learnings through our work. And so we met with a communications team called Matter Unlimited, and we did the usual stuff in which we identify our goal, which was to inform, persuade, and most importantly, not just stop there, but to really catalyze and activate with key audiences, and honing in especially on decision makers and thought leaders, and that there are other kind of secondary goals that we want to achieve. So this was the real breakthrough for us, just in terms of really coming to realization about why we're doing this. And it really is to communicate, to build power. And that instead of the traditional way of communication where we're doing it on behalf of or for impacted communities, we wanted to make sure the communication is done by and with impacted communities, and that they're the ones advancing the solutions and developing them to inform policy making. And then you can see some of the other kinds of shifts that we wanted to make within this framework that really guided our decision making about what strategies we chose. And then we had some guiding principles as well for our strategic communications. And I just circled a few of the ones that we thought was really important to highlight, especially based on what Amber just said. that we wanted to make sure that our youth and resident leaders' stories are the hero, and that we wanted to make sure that we combine the quantitative, hard-hitting impact and data with both visual and written storytelling, and that we want to bring to light their stories. And then the other one, which is equally important, is that throughout the area of change, is that we want to demonstrate an inextricable link between health and racial equity with the social determinants of health, again, through storytelling and of the data that we collected. And so we set about to do that, and we wanted to make sure that we really lift up the voices of folks like Ramla Sahid and Nicole Kababa from our communities, our grassroots leaders. And every opportunity we did, we really made sure to bring into the fore our partners like Sylvia, Kim, and Andrea whenever we went out and spoke to folks. So I'll just stop there, and there's just so much to tell, but really invite dialogue in terms of how to go about doing this in ways that really honor communities, and to really be authentic to how we want to build and lift up our communities and build their power. So with that said, I'll hand it over to Mark and stop sharing my screen as well.
Great, thanks, Hanh. Nice to see you again, Hanh and Amber. I enjoyed prepping for this session with you and learned more again. Thank you, Dr. Woolf, for opening things up, and Jessica, Ivory, and Julie for making this happen. My name is Mark Cabaj. I'm in the city of Edmonton, Alberta, Canada. This is Treaty 6 country, home of many First Nations, Métis, and Inuit. And I'm glad to be able to contribute a little bit to today's topic. And in fact, it does sort of build in a way on what Amber and Hanh were sharing. And it comes from the perspective of someone who does a lot of developmental evaluation, that is evaluation that's attuned to innovation and systems change. And I never wanted to be an evaluator. No one really grows up wanting to be an evaluator. You end up doing it because you find out why it's so exciting. But I worked in international development overseas, and I was a frequent user of evaluation and a frustrated user of evaluation for lots of reasons. It seemed to come late. It didn't answer questions that I was interested in, etc. And in fact, the research on evaluation is quite good. Evaluation use, it's very low. Depending on the study you find, we've been doing use studies for 40 or 50 years. It's consistently low. And there's lots of reasons to that, for that. And but it does mean in order for evaluation to be useful, including the communication of findings, I'm always perplexed about how to do that. And the thing that stimulates me is a quote I've heard from an observer of the Canadian Federal Public Service, who said evaluation in the Canadian government, turning a crank that's not attached to anything. And so it's kind of grumpy as a quote, but I think it's pretty accurate. So I'm consumed with how to make evaluation useful. And so I'm a cover band and a disciple of Michael Quinn Patton and many others who talk about utilization-focused evaluation, which has as a very simple premise. Evaluations often have different users with different uses in mind. Amber and Hanh were speaking to that directly and indirectly. So no one size fits all. If we're really going to make evaluation useful and demand-driven, we have to be clear about who wants what information when, packaged how, and for what purpose. So there's a plurality, a stance on plurality that's really important. And so what I'm about to share from that is not counterintuitive, but it's countercultural in the evaluation field, maybe the communication field, I don't know it as well. And that is, if communication findings are to be useful, here's the big idea. We actually have to make sure that the primary users, the innovators, those who are trying to make change, get their needs attended to first, and then we worry about communicating to other audiences. I'm actually going to give you a quick story of that, and then I'll show you a slide or two. And this is a provocative story. I chose it to be provocative because we'll remember it. About 9-10 years ago, I was an evaluator for a project with Native Counseling Services of Alberta, and the project was a program directed at First Nations kids, younger kids, early teenagers who are at risk of joining gangs. And sat down as an evaluator and asked them to surface what their evaluation questions were and what methods and indicators they thought might be useful to answer them. I was trying to be responsive. And they were consumed with an external audience, in this case, a funder and a whole bunch of policy people. And they said, we'll get to our stuff, but what these folks really want is a social return on investment of this program. And so they said, could we just start with the social return on investment and get to what we need? So I said, before we do that, let's develop a little data dress rehearsal. We're going to do a simulation. I'm going to come back with the social return on investment analysis with mock data. And we're going to actually walk through the findings, pretending they're real. And I'm going to ask you what you're going to do with that to see if it's useful for you. Came back 2 weeks later and presented a mock-up, and it looked pretty good, had charts and numbers and information on what kind of methods we would use. And I said, so here's the real test. So what will you do with this information as the innovator team, which included Indigenous leaders from across Edmonton. And the deputy chief of police was writing on the back of a napkin, and he said, I just realized the best social return on investment would be if all these kids would die. He goes, we'd save so much money. And of course, if any of you have read Jonathan Swift, the Modest Proposal, you know what he was doing. He was provoking everybody. And he said, I don't want this information. This doesn't help me do anything. I will never make a decision based on this information. So I was happy. I said, so what do you want to know? And he says, I haven't heard about some of these gangs. I want to know how they're getting to kids so early. I barely know what the nature of the problem is. So I want to know more about the nature of the challenge. Someone else jumped in and said, I'm an Indigenous leader from Saddle Lake, northeastern Alberta. We have a big hunch that an Indigenous elder is going to work with these kids, but I don't know if it's going to. How do urban kids deal with elders? We don't know that. So he had a whole stream about learning about the intervention. We went through the list, and the innovators had real questions about what they were trying to achieve and how. What does resiliency look like for urban Aboriginal kids, Indigenous kids? What does their pathway look like getting out of here? So we actually said, we're going to do a social return on investment, and we did. But it was an appendix. Most of the evaluation was answering the questions that they wanted to know. And the final appendix actually included a social return on investment, one for each archetypical kid. We created archetypes of the kid. And the story that was most profound was the kid who had the worst social return on investment. The numbers were terrible. And the reason they were terrible is this poor kid had no networks, and the only way he could escape gang life was to go back into youth detention. Right? Brave kid. So that's just a real visceral, provocative statement to say primary users, in order for external communications to be useful, first we have to make the primary users really clear about what they want to learn and why and in what manner. And that takes a lot of work to tease out and to suss out and design an evaluation around that. And the better and more bonded they are around what they want to learn, the better they will be able to turn externally and retail different insights and learning for different groups who may know something else. The better they will be able to then accommodate evaluation interests that may not be their own, but they may know that it might be useful for field building. So there's a couple implications of this, but the metaphor that I have in mind is, I think we shared this last time, Amber and that I have an image of being in a plane, and you know that little commercial that comes on, and it says, if we lose oxygen, put the gas mask on yourself, not the gas, but the air mask on yourself first. I think that's what social innovators should do. Change makers, whether it's a philanthropy, grassroots effort, some multi-sector collaboration, primary users are the innovators, secondary users are everyone else who need to learn from the primary innovators. So that's not counterintuitive. It is countercultural, though. And I'm just going to show two slides that share a little bit of what that might look like in practice and where we might go for more information on that approach. So Julie, or Jessica, if you can share it, thank you very much. Oh, we'll go to the next slide. There's a slide of a table. Yeah, there we go. Anyone who's done human-centered design knows this idea. Go talk to people who are supposed to be the primary user and ask what they want. Ask the questions they're interested in. Ask if they have any preferences for how the data is gathered, analyzed, and delivered. Hanh and Amber, you've had examples of this. Ask when their windows of use are. And guess what? They won't know half the time. They've never thought about it. They only know when they see an evaluation product or communication product and say, that's not what I want. We need to get these signals early. We need to find out who wants what information, when packaged, how, for what purpose, including primary and secondary users. And then we can geek out on evaluation designs and communication protocols. Let's surface the demand side of the change makers first. Pretty simple practice. And if we go one more slide, Jessica, I'll be ending. I think communications will be a lot better if we adopt a utilization-focused approach to evaluation and communication, which is based on being clear about who's using it when. And evaluators can be a much better friend to communications people, those people who we need in change efforts, if we get better at facilitating primary user-centric evaluation designs as well as communication designs. I'll leave it at that. I hopefully you remember, if anything, the story about social return on investment and why that may not have been the right technique, even though some external user wanted it. And I look forward to the discussion that follows.
Thank you, Mark. That was actually all three of your fascinating presentations.